Hi, welcome to Sovereign Health. We're going to go on a tour. Come on in. This is where our patients program. You can come to the right here. There's an area where they relax, they get to know each other, and they can sit here between groups. This is where art therapists work with the patients. Patients literally have fun in here. They work on core issues while they're working on art. Staff keeps an orderly account of all the patients while they're here. So if someone gets lost, someone doesn't know where they're going, there's always a staff member here to direct them. This is a therapy room where patients and their family can come in and have therapy with their therapist. Therapy is an incredibly important part of recovery. This is where they get to the bottom line of what's happening in their lives. What is wrong with them? Why do they feel different? So therapy is a time when they can learn to trust, they learn to move forward and heal. This is where they begin to heal. This is another therapy room. We have 2 psychiatrists and 1 physician that comes in and treats patients. Follow me this way. Whoop, there's another group room. We can pass that. This is the medication room where nursing staff is, and they give out medication here for all the patients. This is substance abuse counselors and patient advocates. They are in here because they have access quickly to the med room if patients need something. This is the cognitive lab. This is where patients rehabilitate their cognitive skills. We call it neurobics. And they work with brain teasers, they work with different games. They think they're playing games, but they're really working on their cognitive skills and rebuilding the resources that they used to have. And right this way, this is where patients have snacks. It's their snack area. They have drinks and snacks throughout the day. This is another group room. Group room 1 is the room where there's primarily, this is education on mental illness. There's education on mental health. There is also education on addiction. And this is where patients learn that they're not responsible for every bit of their addiction, that it is a disease, that they have to work with it as a disease so they can heal and get better. I'm going to show you outside. This is where patients relax. They come out here to eat their lunch. They smoke out here. They talk out here. This is where a lot of communication happens. This is our kitchen area where our cook prepares all meals. They have their breakfast here. They have their lunch prepared here. They take it buffet style and then they eat outside. But patients primarily eat at their houses because they do have dinner there and they work to prepare together. Here's another group room. This room is a great room. They use this for art therapy, as you can see by the table. They also use this room for education because we have a monitor on the wall. Films are an easy way for patients to really digest the fact that their disease is not of their own making. Their disease is addiction, and it's a brain disease. Here's another group room. This again has a monitor. This is an education room as well. They work on mental health, mental illness, and addiction. They also process in this room. Okay, come on in. This is a case management office. Case managers are, again, not in here very frequently. They're with patients for 5 to 10 minutes every day. So that means they see each and every patient every day for at least 5 or 10 minutes to check in to see what's happening with them, what's going on with them, and to plan their aftercare. So they're very busy. This is another therapy room. Okay, we have a large staff of clinicians. And another therapy room. And therapy also includes family therapy. It's not just individual, it's family as well, which is why the telephone is there. If a family can't make it to Los Angeles, we use the telephone and do conference calling and have therapy over the phone. This is where the therapeutic staff works. These are the foot soldiers that work with each and every patient. They brainstorm, they work on anything that they need. Each patient is individually treated. So they work on brainstorming, reporting, to make sure the treatment is a healing product for the recovery of each and every patient. This is the operations department. This is the lunchroom. This is where our staff, the people that work with each and every patient, work with you, will be working. Thank you so much for coming on this virtual tour of Sovereign Health Los Angeles with me. Please call us if you decide you need help, if your loved one needs help, or if you don't know if you need help. Please call us and we can be there. Thank you.